get the universal health care. So that's why we are here today. The second project, we are here also to launch part of the road which we announced will be the slum upgrade project. So from here we are going to visit official commissioning of the start of work by the contractor within Kibra to repair all the roads in all the slums. If I'm not mistaken, we are doing almost 11 slums and disadvantaged areas, and the roads that the contractors have been given cover 440 kilometers. That will be done within 1 year. So 1 year from now onwards, there'll be no slum in Nairobi that the road will not be tarmacked. Some of these roads will be narrower than others because most of the slums have been put under special planning area. Special planning area will accommodate the road being narrower than the standard one because the space available within the houses in the slums are narrow. So that's why we have placed and gazetted all the slums in Nairobi to be put under special planning area. That will give us access to make roads that are a bit narrower but are passable, especially not only for transport vehicles but for emergency vehicles like fire vehicles and ambulance, which before never had access. And any disaster happening in any slum resulted in casualties. We are now trying to minimize by making sure that all the roads within the slums are tarmac to the required standard. So that's why we are here, and now I'm ready to ask any queries that you have.
You mentioned
and before I forget, we are also launching the opening of the 24 hospitals that we are doing in all the slums and disadvantaged areas. From mid of this month, we'll be opening 2 hospitals per week, and will continue until the 24 hospitals are commissioned and running in all the slums areas, all the disadvantaged areas. These hospitals will be free to all the public. Also going on with the hospitals, we'll be commissioning several boreholes within the slum areas. We have already completed the 100 boreholes set within all the slums and disadvantaged areas, especially in Eastlands and Kasarani areas and other areas that have had lack of water. Remember that during our first 100 days in NMS, we did 93 boreholes, and now we have completed with Ministry of Water another 100 boreholes. So these will also be commissioned alongside the opening of the hospital. So all these development projects will run hand in hand. Thank you very much.
BD, you mentioned that you've identified about 290,000 families.
Yes.
And the slots available are 66,000. Do you have perhaps a time frame that it will take to, bring the rest of the families on board?
Let my Director of Health answer that.
Yes, as the Director General has already mentioned, the families that 290,000 were all the families that fit the criteria of poor and vulnerable. But as you already know, everything has a budget limit, so they will be ranked because even the poverty, there is already a criteria. So we'll start with the 66,000, and that will be by 1st of March. The exercise will be done, and they will already be ready to enjoy NHIF. And as Director General has already mentioned, this is part of the access program for the 24 hospitals, because as you know, he has already mentioned it is all free. So it's the NHIF card that will happen. But as we move forward, every household, we will be enrolling a UHC policy so that people who are able to pay for themselves, we will be encouraging them to pay for themselves, but those that in the future will still fall within the vulnerable, we will be looking at the budgets from the next financial year and the other financial year so that it's progressively growing. This is what is happening in all counties and everywhere. You start with the most vulnerable and you increase until you cover all of the 290,000. Nairobi has around 700,000 families, and some of them are working families. So those ones, with the policies that are there, they are able to pay for themselves NHIF. And then we start with the 66,000. Some people are in the informal settlements. In the informal sector, as the Director General has already mentioned, they will be working very closely with the private sector, the construction industry, to pay for some of them. And then as we progress within 1 year, we will be able to reach out to the 290,000. Thank you.
Do you have a number for the budgets that have been allocated to 66,000 families?
Number for budget?